Good morning and welcome. I am Nina Heller, the Dean at the UConn School of Social Work, and we are delighted to have you all here this morning. And for many of you, this afternoon and this evening. So we have an international panel and international audience, and we are delighted to have you here. I want to thank our director of the UConn International Center, Rebecca Thomas, and also our founding director, Dr. Lynn Healy, for being here, and all of our panelists who you will meet shortly. Thank you for that. I can't think of a more timely presentation. As we all know, the COVID epidemic has affected all of us across the globe in every domain of daily life. And I think it's particularly important for social work to stake out what our concerns, what our roles are, and what our potential solutions are as we move forward in this deadly pandemic. So thank you to all of you for being here, and we look forward to a really invigorating conversation. Thank you and enjoy.
Thank you, Dean Heller, and greetings. My name is Rebecca Thomas, and I'm pleased to add my welcome to all of you for joining us today. This special program entitled The Global Impact of COVID on Social Work Response is being hosted by the Center for International Social Work Studies at the University of Connecticut School of Social Work. The center has been established to promote knowledge building and professional competence in international social work and human rights. Dr. Lynn Healy was the founding director and served as the director from 1992 to 2012, with assistance from the advisory board comprising of faculty, staff, and students. At this time, I want to thank our advisory board who meet monthly to provide direction and oversight on our programming, the activities of the center, and our research initiatives. We are pleased to have so many faculty and staff engaged in international social work, especially our new Associate Dean, Dr. Joanne Corbin, who will be moderating this event, and our new faculty member, Dr. Rupal Prakash, who introduced us to Joel Cruz, our speaker from Hartford. I also want to thank our faculty who have continued to serve from the time I've been at the center. Dr. Louise Simmons, a thought leader on economic justice and urban social issues. Dr. Didi Drachman, who focuses on transnationalism and immigration, and Dr. Kathy Liebel on human rights. Our staff, Gina Divo Brasio and Marilyn Cardone from the field department, and thrilled to have Milagros Moreira Johnson, Director of Strategic Programming, join us again in her new role. I want to thank Milagros for her assistance in putting this programming together. And finally, our students placed at the center who work hard each year to further the goals at the center. This year, we have two students, Emma Hines and Emily Buzak, who have been working really hard. As a kickoff for our programming, the advisory board proposed that we learn from our colleagues locally and globally on the impact of the global pandemic, COVID-19, from a global perspective. Even as we speak, the numbers in the United States, rates of infection and deaths are growing at alarming rates. We are so fortunate that the School of Social Work recognizes the growing importance of social work's involvement in learning and understanding international problems and solving and policy development, a global perspective on human needs and social policy and practice, interventions that can best address social problems of an increasing interdependent world. And now at this time, I'd like to invite Dr. Healy, who continues to serve as a very active member of our board, to introduce our speakers.
I think I'm Joanne Corbin, and I will have the pleasure of introducing Dr. Healy, who will then introduce the panelists. So thank you. Good morning, everyone. I'm Joanne Corbin and the Associate Dean for Academic Affairs at the School of Social Work. It's my pleasure to introduce Dr. Lynn Healy, who is a distinguished professor at the University of Connecticut and a professor at the School of Social Work. Len has spent her entire academic career preparing social workers for international social work. And I mean this in the broadest sense. She looks at international social work from both a local and a global connection, and looks at social work in practice context throughout the world, and prepares social workers to enter those fields and to be mindful of those fields. She has numerous publications. I won't go into them all, but the most notable are International Social Work, Professional Action in an Interdependent World, and the Handbook of International Social Work, Human Rights, Development, and the Global Profession. Her leadership in this field is remarkable. She has had leadership positions in most international associations, including the Council on Social Work's Commission on Global Social Work Education, the Catherine A. Kendall Institute for International Social Work Education. She, as you've heard, was instrumental in the development of the Center for International Social Work here at UConn and served as its directors for many years. And she has also had leadership positions in the International Association of Social Work. On a personal note, I've known Lynn since about 2005 when I began my work in international social work, and she has been a generous colleague and supportive friend, and I look to her for guidance often in this field. Without further ado, because I know we have a full program, I would like Dr. Lynn Healy to introduce our panelists this morning.
Good morning to everybody, and good afternoon and good evening to some of our panelists and perhaps some of our participants. You always have to look at the clock when you're trying to plan an international event. I know I got asked to sit in on a dissertation review and realized it would have been 3 in the morning for me. That's not when I'm at my best. I'm really delighted to be able to introduce this distinguished panel. I'm going to introduce all 3 panelists at once because that will speed up the way we are navigating this new way of delivering seminars. So I will begin with our first speaker, Dr. Vimla Nadkarni, who is a retired professor and dean from the Tata Institute of Social Sciences in Mumbai, India, which is the oldest and most prestigious school of social work in India, founded in 1936. Vimla is a global leader in social work education, having served as president of the International Association of Schools of Social Work from 2012 to 2016. Among the many accomplishments during her term was the signing of a memorandum of agreement between IASSW and the United Nations Agency on HIV/AIDS, UNAIDS. This was a project that yielded a major seminar and also a book on the role of social work in HIV/AIDS. And as I thought about that book, which is published, I believe, in 2018, it really would be a model for a new book on the role of social work in COVID-19 globally. Dr. Nadkarni's areas of expertise include social work education, international social work, qualitative research, and especially relevant for today's program, health, including HIV/AIDS, community health, and health ethics and human rights. She's published extensively in each of these areas, including, interestingly, I picked this up from her Vita, several articles on social work interventions to deal with pollution. She's received a number of honors, including Kellogg and Fulbright fellowships, and was selected to give one of the Hockenstad International Lectures at our national CSWE conference. Since retirement, she has co-edited a book on field instruction and is coordinating a working group advocating for a National Social Work Council for India. Our second speaker, Dr. Lena Dominelli, holds a chair in social work at the University of Stirling in Scotland. There, she is director of the Disaster Interventions and Humanitarian Aid Program, which will be the first master's of its kind in the United Kingdom. This program is due to start February 1st, 2021. Lena has a long history and has taught at several other major universities in the United Kingdom. Dr. Dominelli chaired the Women's Caucus of the International Association of Schools of Social Work. I believe that's when I met her. and then served as president of the IASSW for 2 terms from 1996 to 2004. A number of the most important policy documents in social work were negotiated during her term, including a new ethics document and the first ever global guidelines for social work education. She has continued to be globally active in social work and is currently chair of the Committee on Disasters and Climate Change and represents social work education on the United Nations Framework Convention on Climate Change. Dr. Dominelli is a prolific author, and it would actually take too much time for me to even list the titles of her books, but I will mention a few because you'll see over her career how she has always been ahead of the curve in terms of what she's writing about. She has a book, Anti-Racist Social Work, which is now in its 4th edition and was first published in 1988. A book on feminist social work theory and practice. Another one, Anti-Oppressive Social Work Theory and Practice. Had to write these out. I hadn't memorized all of them, some of them. Green Social Work, 2012, and the Routledge Handbook of Green Social Work, published 2 years ago. She's received a number of honors, including the 2012 Catherine Kendall Award for contributions to social work globally. And interestingly, according to the website of her university, it says that Dr. Dominelli has been supporting social workers and providing guidelines on COVID-19 since early January 2020, beginning in China. So we look forward to hearing Lena today. Joel Cruz will be our 3rd speaker, and we'll round out the panel by bringing us back to the US situation and the local dimensions. Mr. Cruz is Senior Manager of the Institute for the Hispanic Family and Strengthening Families program, with over 15 years experience in community outreach, public speaking, nonprofits, program development, social services, mental health, healthcare, and public policy. He also had a career as a politician and was a member of the Hartford City Council. While he was council minority leader from 2012 to 2015, he authored numerous ordinances to help address quality of life issues in the city of Hartford. He also is a former Marine, having served 8 years in the US Marine Corps. He's currently the vice chair for the Charter Oak Health Center Board of Directors, a commission member to the Town of Windsor's Youth Commission, a reviewer for the Council on Accreditation. He's a certified fatherhood family life coach, master trainer with the National Partnership for Community Leadership, and the member of the Prevention of Child Abuse Advisory Committee. In the past, he also served as vice chair of the African Caribbean American Parents of Children with Disabilities Board and a member of the Hartford Hospital Pastoral Services Advisory Committee. So we have 3 panelists who have a wealth of background to share with us today, probably enough to fill a day-long seminar, but we will do our best this morning. And I'd like to now recognize our first speaker, Dr. Vimla Nadkarni.
Dr. Nadkarni, you are on mute. If you can unmute your mic.
Sorry. Okay, so I will just repeat myself. I'm honored to be here, and thank you, Lynn, for the introduction. And I know that we have a very short time for presentation, but I will try my best to keep to the time. Can I have the slide, please? The PowerPoint, Milagros? Yeah, thank you. I will start with an overview of the impact of COVID-19 in India, and then go on to the social work response, taking a few illustrations from the field, and then I'll end with some recommendations. So as you can see from this slide, that, I'm sorry. Yeah, as you can see from this slide, that the cases have been going down, from, if you look at May, from May to November, the cases have been going down. But in fact, just today, there is news that after, since the lockdown is opening out, cases are again increasing in some cities of the country. So we will have to see how it sort of shapes itself, the curve. But we've had 8.68 million cases of COVID and 128,000 deaths so far, according to this statistic. The case fatality rate is quite low. As you can see, it's 1.5% in India compared to 9.8% in Mexico. Next, please. Next slide, please. Yeah, this is just showing the map of India. And of course, we don't have time to go through it. I just wanted to, I don't have a way to sort of highlight. You can see Maharashtra on the west coast. That's where Mumbai is. And it's a state where you have the highest number of caseload. And we are in Mumbai, and Mumbai also has been having its own problems. Next, please. Next slide, please. Yeah. Before that, go to the previous one. Yeah. Interestingly, that India's response has been very prompt and rated as one of the most stringent in the world, exceeding some of the countries, the developed countries. Immediately, the international borders were shut like many other countries. There was a nationwide lockdown since March 25th, and it is opening up slowly only now since October. But with a warning from the Prime Minister, reminding the citizens that even if we are opening up slowly, we have to take care, we have to take precautions, wear the mask, keep a distance, etc., etc. And during the lockdown period, the tertiary care provision has increased. We have 2,000 dedicated COVID-19 facilities which were developed over a short period of time. Of course, there is an urban-rural variation. We all are aware that there is a concentration of health infrastructure in the urban area, but a very vastly spread infrastructure in the rural. However, there is more urban than rural concentration. Social intervention, since it was a very sudden, unexpected kind of disaster, the immediate response was more a public health response, a medical response, how to deal with the cases, infected cases, etc. So you will find that the social intervention took time, and it was mainly a civil society and NGO response that initiated the process. This slide shows the number of COVID, the number of testing rates that increased, again reflecting how India responded to this whole pandemic. 120 million tests covering 15% of the population. I think you all are aware. Next, please. Our challenges. Next slide, please. Of course, I'll come to the challenges later. Economic benefits have been distributed to the poor through direct cash transfers, about $20 over 3 months to women, the poor women with bank accounts, and upfront transfer of about $14 in old age, widow and disability pensions to 30 million recipients. And also farmers, the small and marginal farmers have benefited with $80, which is still being distributed in installments. And 800 million households would also get free food grains for 3 months, while 83 million households would get free cooking gas. These are the benefits being provided by the government. Next, please. Next slide, please. However, we see major challenges for India. One is that it's a huge country with 1.3 billion population. At least 27% or more live in very small houses, shanties, in the slum colonies, 10 by 10 foot. There may be 5 to 8 people living in one room. So you can imagine the challenge for India. How do we maintain that social distance? I would say physical distance when you have such crowding, and not only the house, there are a large number of people, but even the pathway to the settlement is narrow, and it's very difficult to maintain this kind of physical distance that we are expecting from our people here. We also have 140 million migrant daily wage laborers. You may have heard of the sudden movement of these migrant laborers after the lockdown because they lost their jobs. They were starving here in the cities. So they started moving towards their villages, and many of them walked hundreds of miles from, say, a place like Mumbai towards the north. And there were several deaths on the way because the government, since it was a very unplanned lockdown, the government had not anticipated that the laborers would start moving away from the cities because there was no construction work available. The restaurants were closed. The street vendors had to move away. The vegetable vendors had to move away. There was no transport available for the products to enter the cities. So there were no sales. The other challenge that our country is facing is that the doctor to patient population is very low. You see the ratio of 0.8 doctors per 1,000 population compared to many of the developed countries. We've also unfortunately had natural disasters during this time where people are now living in cyclonic shelters. Can you imagine the crowding in those shelters? It is impossible to maintain distance between them. Because of the pressure on public health system, on our infrastructure for treating COVID infected persons, several other programs have been neglected. And just an example of 100,000 to 200,000 children have not been vaccinated in February, March, because now everybody is, moving towards only treating COVID affected people. And of course, we have this whole issue of administrative incompetence and corruption. So even if the central government, has promised the people transfer of funds, there are people, women, for example. Next slide, please. Women who don't have bank accounts, women who do not have ration cards. So how are they going to benefit from this kind of relief? So there is a Prime Minister's, this scheme for cash relief, where the women have to open bank accounts. But then you see the figures here, that 53% of the women, poor women, are excluded from the cash relief, and 21% are excluded from aid, which is tied to ration card. Ration card means that they have to go to the ration shop and they will get basic grains, rice, the dals, the pulses, and sugar, salt, etc., which they are excluded from. Next, please. So, keeping all this in view, how important social work is, how essential social work is during this pandemic, in relation to educating people, giving information, coordinating with government agencies to provide relief, coordinating with government agencies to provide testing and contact tracing, providing for helplines and hotlines for counseling, because a lot of people, have so much fear. Even today, we know that people are afraid, students are afraid to come out in the open. They are not going to school, they are not going to their colleges, and many of our institutions of social work have still not opened, classes have not started. Next, please. So I'm giving you just quickly three examples of three organizations. That is the YUVA India, which works with vulnerable groups. And interestingly, these two, both YUVA and CHILDLINE, were field action projects. One from Tata Institute of Social Sciences and one was started by students of the College of Social Work, Nirmala Niketan, Mumbai. YUVA India is now working in 5 states of the country. It has registered as an independent NGO. And Childline India has become a government nodal agency program of the Ministry of Union Ministry of Women and Child Development. And we have this very large national service scheme which covers college students between the ages of 15 to 25 years who are given some credit to complete 240 hours of community service. And these are opportunities. This scheme is also meant for personality development. Next, please. I'll go to YUVA. YUVA strategy has been to locate relief work and associated advocacy within Right to Life framework. So it has provided relief and support to protect the dignity of people in distress in partnership with local groups and people's collectives, ensure access to state-provided entitlements, and ensure people's agency in the access of rights. Next. Next, please. So there, the methods and tools they have used is a rapid needs assessment and ongoing research. There's an excellent report that they have brought out, living with multiple vulnerabilities. They studied the homeless and the urban poor, the migrant population, and they brought out a report in August 2020. They even started a Together We Can campaign for fundraising and also for linking with citizens and civil society organizations and NGOs to work together for relief and other interventions. They've provided immediate relief to people, most marginalized people. They've done advocacy and lobbying with the government and use of social media, wide use of social media. Next, please. Childline is a helpline which reaches out to children across 595 districts through 1,030 intervention units and 136 child help desks at railway station. 90 million calls. They have received 90 million calls over the last 20 years, and they receive 25,000 calls a day. Next, please. So since March 28th, since the COVID lockdown has happened, they have received 2.75 million calls, and they have helped. They have made 200,000 interventions where frontline workers have reached the location of a child to provide assistance to or rescue a child. And there are many examples that they give where they've had to help a family, where the child is abused, so to remove the child from that family, and many other such assistance they have given to disabled children and children in need of assistance. Next, just next slide. They work with they work with different stakeholders, with district administration, child protection bodies, health departments, law enforcement, civil society networks. Next, please. And they have also been involved in emergency relief and rescue. Next, please. and providing counseling and psychosocial support. And as you can see, they have also developed a manual for parents and caregivers in collaboration with UNICEF. Next. Like I said, we have these National Service Scheme student volunteers who have also been involved in relief work. This example I've taken from one of the colleges of social work, where faculty who is the program coordinator of these volunteers, college volunteers, they together sort of did these interventions. So supporting the local administration for providing relief, also distributing masks and sanitizers, and students also were taught to make the masks and stitch masks and distribute them free. They provided services to short shelter homes and quarantine centers, and also sanitized villages. So they helped in that. And of course, they also distributed food packets to displaced persons in forest reserves. So it was not only in the urban area, but also in the rural, in the areas where the tribals live, and where the people are in forest reserves and they are in the process of being displaced. Next, please. So finally, I'm coming to, based on these examples, what do we need to do to strengthen the social work response in COVID times in India? One is that we need to strengthen education and practice in disaster management. We are central University Grants Commission, which is in the central government and which monitors education, provides funds for higher education, had very clearly sent an advisor to all the universities in the country to have courses on disaster management. This was done a decade ago, more than a decade ago. So most of our colleges of social work had to have these courses. Some colleges have even set up a master's. For example, Tata Institute of Social Sciences has a school for disaster management and disaster preparation, prevention, etc., etc. So there's a school and they give a master's degree both in the sciences and in the arts. So this is something that we all need, because COVID-19 has been a very unexpected disaster for all of us, not only in India, but all over the world. And these are the skills that we need to deal with it. And I'm sure Lena Dominelli, who's an expert, will talk more about that. The other very important role that we have to play is to link people with government programs and resources. The government is promising a lot of cash flow, opening of bank accounts, helping the poor in different ways, providing supplies to the ration shop. But the point is that first of all, the people, do they know enough about these programs, that they have these entitlements, they have a right to these entitlements? So to link the people with these resources becomes very important. Then also we have skills in research, in doing rapid needs assessments and ongoing research. So building evidence and using that evidence, disseminating the data and using the evidence to raise people's voices for, getting the government to pay attention to the poor and the most vulnerable. We have our methods which we need to strengthen. Community organization becomes very important, social action. We need counseling, networking, advocacy, and policy development. There are very good articles that the students may be interested in, which talk about ethical practice in COVID times and the dilemmas of ethical practice, and also importance of policy development, how there is a shift in the attitude of governments from, you know, being a socialist, welfare-oriented programs to, you know, putting the responsibility only on the citizen, on the people who are poor, who have no you know, resources. So how to influence that policy and keep those programs going for the poor? And of course, new areas of learning, working with displaced people in wildlife protected zones, with migrant workers, with mobile indigenous people, the gypsies, etc. So these are some of the recommendations that, you know, we need to look at in India. I'm sure there are many more suggestions that would come through with the help of our panelists. I think I'll end here. Is there another slide? Yeah. Thank you so much. Thank you so much for your patient listening. I'll be happy to, you know, entertain questions.
Thank you. We will entertain questions at the end of all of the presentations, but thank you for that beautiful presentation and the scope of the work that is happening in India. Dr. Nadkarni, thank you. I'd like to turn to Dr. Dominelli now for a presentation, for her presentation in this area. Thank you.
Hi, thank you very much, Joanne. It's a pleasure to be here with so many distinguished colleagues. I feel very privileged and honored. I'm going to share my screen. I do have some slides, but I tend to just talk. So bear with me and I will put the screen share on. And can everybody see the slides now? Yep. Okay. Oh, okay. So how about starting with the first one at the beginning? Right. Okay. So I'm going to take you through a quick walk. So get your walking boots on and talk to you about COVID from a green social work perspective. Because as Lynn said, this is my latest baby, I guess. In the absence of a small baby, he's too big now for me to hold him as a baby. But I wanted to talk, first of all, in my discussion, I will talk about what is COVID and why do we need to take it seriously from a green social work perspective, because it really is new and different. Then I will talk about some of the narratives that I have accumulated in the course of my work with people since January, when COVID first hit social workers in Wuhan, China. And then I moved on to other countries, and I'll say a little bit about that. And then I'll conclude with where do we go to from here, all from a green social work perspective. So the first thing about COVID is that it's a zoonotic disease, which means that it comes to us from animals. And it comes to us from animals because we have gone into their territory to be the, I guess, the purveyors of their kingdom. And we're paying the price, which is that animals in that kingdom have been reservoirs of many, they still are, many different kinds of viruses. And the coronavirus managed to mutate and join up in our lungs. I won't give you all the scientific. I've done so much studying on this, I could give you a whole lecture just on the science behind this. But what it means is it's come into our bodies and we have not got the immunity to fight it. So it's new, it's different. It has predecessors that we've known about, like SARS, MERS, and H1N1, H1N9, which were big flu pandemics, swine flu, all sorts of things. They were also coronaviruses, which are different from the virus that we had in the 1918 influenza. That was it was a Hep virus, so that was different. But the coronaviruses, we managed to control for SARS and MERS and H1N1. Why? And I think it has a lot to do, the question is an open-ended one, but I think it has a lot to do with the lack of global solidarity and unified action around COVID-19, which was not the case for SARS or MERS. And I know I'm a Canadian by origins, And as a Canadian, I was in Canada when SARS broke out, and the instant reaction by the government to quarantine everyone and to stop travel, because that's the biggest thing. It's that interaction. And that's why we have to social distance, but also physically distance. They're the two together. And some people in Britain call it the antisocial distancing, because it is antisocial, because it gets away from our desire as human beings to connect with others. But our politicians all let us down because they didn't do that connection at the global level. And we'd be remiss if we didn't talk about it. It was defined as a pandemic on the 11th of March. And since then, it's gone all over the world, and there are nearly 54 million people who have got it. And sadly, the US and the UK and India and Brazil are doing very badly. And I include the UK in that because if you look at a population basis, actually the US is one below us, believe it or not. You've got 73 people per 100,000 that are infected. We have 74. So our population is much smaller, of course, so you get some distortions from that. But it is quite worrying that we failed to actually deal with this as an international community. So it really grieves me as an internationalist a lot. But why a green social work perspective? Well, A, because that's what gives me the analysis that says this is caused by us breaking that barrier between human beings and animals, which should really be respected. And I won't go into all the things that we've done all over the world, including in Canada, to break that boundary so that there are bears in downtown Vancouver. But we need to care for the planet. And I think the biggest impact that green social work has had so far is to convince people that we have a duty to care for our planet, that the planet will care for us as long as we care for it. So we should stop exploiting nature as a means of making profit for the few. It should be there for everybody's benefit, not just for some people to make money and the others to starve and go without food and medicine. It is also about human rights and egalitarian values, which we all know as social workers. And it also wants universalism in accessing health and education. And whether you agree with it being free at the point of need or not, this becomes really important in COVID, because if the vaccines do not become freely available to poor people in the global south particularly, but also poor people in the global north, we know from statistics in the US and in the UK that poor people living in disadvantaged communities and people of, well, we call them Black people, you call them people of color, but people of minority ethnic groupings are the ones who are more disproportionately affected than others. So that means we have to have universalism as a criterion in there. And the other thing it does is to say that we all experience disasters differently. If you're a woman, it'll be different. If you're a Black woman, it'll be different. Sorry, I use the British terms because they're the ones I'm familiar with. But it's really, really important that we acknowledge that. People with disabilities, they also experience disproportionately high rates of disasters. And so we need to worry about things like that. Oh, what happened there? That's not where I'm supposed to go to the next page. Interesting. Anyway, there it is. How that happened, I have no idea, but I skipped some and it just took me to the other ones. But anyway, I want to now talk about some of the narratives of social workers. So I've done the kind of macro level analysis, which is really important. But under COVID, social workers were really, really challenged to start working with people differently. And why were we challenged? It's because we have a profession that is based on relating to people. It's a relational profession. We do relational work. And that was what COVID stopped us from doing, because we were told by our health experts that if you don't socially distance and physically distance, then you will get COVID. And if you're older, and if you're from a Black and ethnic minority group, you will have it worse. And if you are from a disadvantaged white group, you will also be disproportionately affected. So that meant for social workers who were used to doing their works by meeting with people and having detailed discussions with them, they had to do this now remotely, which challenged all of us and raised all sorts of ethical questions. Like I remember some social workers, not just in the UK, but also in China, were telling me, how can we be sure that when we're shown, and even if we ask, can we see the room, that we're being shown everything we should be seeing, like we would be if we were in the room with people. The screen will only show you so much. So that set up ethical dilemmas for people because they didn't know, did they have enough information? Did they have the right information? And who could they get that information from? Especially given that under lockdown conditions, which we currently are in the UK. Again, this is our second one. You wouldn't be allowed to go to do a home visit unless it was part of an emergency service. And social workers, whilst we're classified as essential workers, are not classified as emergency workers to go and break the rules when we don't have to. That raised a lot of anger, I have to say, in Britain particularly, different in China, but in Britain particularly, it raised the issue of whose needs are we really serving? And so a whole group of us got together and pressed or lobbied, would probably be a better word, the British Association of Social Workers to lobby the government to change the law that they had passed under emergency legislation, which said that social workers didn't have to go and do home visits unless it was absolutely necessary and there was absolutely no other way of doing things. So I'm really proud of my profession because it stood up for the people who really needed to be stood up for. And that was really great. In China, similar things happened. Immediately after COVID-19 was recognized as something new and different by their government, social workers were second to the health workers who used to go and test people and then take them to hospital if they had COVID. And in their interest to get people out, they forgot to tell social workers where they'd been or what they'd done. This was in the early days. They got their systems working better later. But they actually missed people with disabilities. And social workers were actually the angst and the worry that they had because one little boy had been left, he was disabled and couldn't move out of his chair for 2 days before social workers discovered them. Now, why did the social workers discover them? Because in China, social workers work at the community level and they have to go and they're each assigned an area, which is like about 30,000 people. They each have to go and look after the people in their group and meet their needs, whether they're food, whether they were medicines or others. So they used to do that. And that's how they found this child and were mortified that nobody had told them that that child was there. So they started doing a lot of work around the technologies to get them to coordinate automatically and to join federated networks so that they could get this information. Other things that the Chinese social workers did, which never in a million years would I see English social workers doing that or even Scottish, were to go out on the streets and test people's temperatures to see if they had COVID fever. They also went around with chemicals to disinfect the communities as well, especially the areas where people shopped and so on. Now we are told in the UK, take your disinfectant wipes and always wipe everything down yourself. This is the do-it-yourself society, right? In China, the social workers had to do that. And because I was supporting them live through Zoom and other methods, I was seeing what they were doing and I was saying, well, what chemical are you using? A, is it appropriate for the environment? Because I always wear my green social work hat on. And B, is it safe for you? And of course, nobody knew the answer to that. So they suddenly realized they need to work in an interdisciplinary way with other people to find out what needed to be done and how this could be done. So, and why. The other thing that I think we need to start doing, but no one, as far as I know, has started to do it yet, is if we're really serious about that transgressing of the human-animal divide, do we need to start asking our agribusiness, our businesses, our commercial businesses, to start thinking about the environment when they do things like tear down Amazonian forests to plant palm oil plantations and other things like soya bean. Well, soya bean, I as a vegetarian will not eat any soya beans because of that. I as a vegetarian will not have palm oil in any products, and it's everywhere, I can tell you, for that same reason. But we need to do this. A single voice is no good. We have to do this as a profession. So we really need to get our act together around environmental issues to protect ourselves from further pandemics, because my studies show that the distance in time between one pandemic and another is getting smaller and smaller. So it's up to us to do that. And the other thing we need to do is to support the Paris Agreement with the reduction of climate change and the use of fossil fuel that accompanies that, so that we do not increase the temperature of the Earth by more than 1.5 degrees centigrade, because if we do, then we're in trouble. Okay, well, I've given you some, and I could give you lots of examples, but I'm aware of time moving on. But there are loads of examples that I can give you about social workers and their heroism. They have, like Vimla talked about some of the things they did in India. And I know that social workers in other places in India, like in Delhi, did similar things and really went to support other people, but they did everywhere else. So social workers risk their lives, and we've had deaths, certainly in the UK, we've had 21 deaths amongst the social work professions that were attributed to COVID, that was contracted on the job. They got it whilst they were working and providing people with a service. So that is quite worrying. And why did that happen? Because as in so many other places, including in China, to begin with, there was not enough PPE, personal protective equipment, for everybody. There still isn't in this country. There is in China, I can tell you. They even sent me 2,000 masks for people in Scotland. And I had sent them 10 when they were needing them, because that was all I could get here. So that shows you how solidarity and reciprocity really works across borders. And I'm so proud of them for doing things like that. But others had terrible deaths amongst the social care, we call them the social care establishments, but these are homes for older people, residential homes, but mainly homes for older people. And this happened in Slovenia, it happened in Denmark, it happened in a lot of countries where disproportionately, once people had got out of hospital, some of them were not tested, certainly not in the UK, to see if they got over COVID or not. They ran out of places in hospitals, so they put them in older people's homes. And guess what? They disproportionately died. We knew that anyway to begin with, because they were an at-risk group, older people over 70. And they also had other compromising comorbidities, as they're called, conditions like diabetes, asthma, and so on, heart conditions. So social workers then really started to think about the wider range of activities that they needed to get involved in. And I've written them down, and I think there's 13 there. I didn't number them, but all of them we know and we do as social workers anyway, except for the last one, which is scientific translators conveying scientific knowledge to communities clearly. And COVID has really challenged us to make people understand, what is this coronavirus? Yeah, it looks quite pretty actually in the pictures that you see of it, but it's deadly. And why is that? And so trying to explain to people how it attacks the immune system in easy to understand language, which I have done through a lot of the guidance I've provided for people, is really important. But that's a thing that is fairly new to us, and we need to really work on that to get somewhere quickly. And then the other thing that we need to remember is that social workers are victim survivors of COVID and other disasters, and that has implications for us and how we work. We should insist that we have our PPE. In the UK, especially in England, more so than Scotland, social workers were telling me, well, if I don't get it, and my risk assessment says don't visit without it, I will, and this is their term, escalate it, which was a new way of using the term for me, to my line manager. In other words, I'll push it up the ladder to someone who can make a decision about either where we get this PPE so I can do my job, or what's going to happen to these people so that they can be seen. So that was really quite interesting. And it was an example of where social workers are really quite innovative and creative. And they also got together in peer groups, which I also supported, to talk about what self-care do we need and how do we improvise. So we improvised, and Vimla mentioned this in relation to India. Yes, we sewed our own masks, but I was able to tell them, because I'd done some research on masks for 2 years, how you can create a mask without having to sew anything. If you've got a scarf, you just layer it 3 to 6 times and put it around, make sure that you seal or cover this part of your face, and then wear your glasses or goggles to protect it from coming into the eyes, because COVID has to get into your body either through the nose, the mouth, or the eyes to get into your respiratory system. And then other things that they did was they were so innovative, and the use of volunteers that they made was really quite important as well. But they kept getting from government pages and pages and pages of guidance, which no one, not even me, and I'm an academic and a fast reader, could read quickly. But you would get sort of like 65 pages coming in several times a day, different ones. And they called it an avalanche of updates. And I thought that was a good term. They said, we're just being overwhelmed by it. We can't cope with it, which is why I ended up reducing them to 1 page to try and help them out. And then mental health was the other big issue that they faced. There were increases in suicides, and not just here in the UK, but in lots of other Western countries, in Europe particularly. And they were worried about social isolation, and they came up with lots of creative schemes for getting people online through groups and getting conversations between them and people who were volunteers, going to see people, but staying outside the house 2 meters away to kind of chat and have just ordinary everyday discussions and take them food and medicines and other things. The other thing that they needed to do was to keep track of everywhere they went, because if they caught COVID, they needed to be able to track and trace. And we still haven't got the system right in the UK, but I can tell you they have in China. You have your smartphone will give you a code. Green, you can go wherever you like pretty well. Well, normally, where you can normally go, you can travel, you can do whatever you like. Amber, you can go and get your food and medicines. And red, you better stay at home. And that is checked every time you go out, and your temperature is checked every time you go into a new building. And I can tell you, Stirling University has introduced something like that in Scotland. Not quite as strict, but if you want to go into the university, you have to go through, your smartphone records you. You have to fill in forms to say that you haven't got COVID. You get your temperature tested, and you're kept track of. So, and they know where you go, because you have to do it for every new building you go into. So things like that did have significant social work input. And social workers are now asking for proper supervision, which means debriefing. And actually, if you're working every day on COVID and seeing people, either in older people's home or the people who are really stressed out by COVID, you will need to be debriefed. So it's important that's part of the self-care. So now you will find that British social workers anyway will talk about self-care for themselves and others. And so what's happened to the slide that kept coming up before, which was, here it is. I don't know how it got muddled up. Anyway, it was in the right place once upon a time. But this is my final slide for saying thank you so much. COVID-19 has challenged a lot of the myths that we have about society. And the first one of these is about sustainability. We have to take the environment seriously in the way we lead our lives. So it's a lifestyle change. We need to do that, and social workers can lobby and advocate for that. The other thing that we need to do is talk about the public good, which suddenly in the UK, this is now becoming an issue. Whereas before, under Thatcher, it was, well, everybody looks after themselves, and if you can't, that's tough for you. Now people are saying community is what matters. We have to care about everyone in our community. So that's great. And social workers have been saying that for years, as we all know. And we work in communities. The other thing is that we need to really celebrate civic duty and neighborliness. And again, you know this in the US even better than I do. Here in the UK, FEMA says for 72 hours, don't expect emergency services to come to your aid. You've got to help yourself and your neighbors and friends and whoever's near you has to look after you. We found that out here through COVID, but you found out through many other disasters like floods and tornadoes and all the other horrible things that happen to you regularly because of the climate. And so people started talking about community support systems, solidarity, mutuality, and interdependence, which we need, and equality. We are all dependent on each other at the local level, I would argue, at the national level, and at the international level. And Lynn has written her book on interdependence of the profession and social workers. So there you are, Lynn, it's right on message. And then the issue of human rights and decent quality of life for all. Certainly in the areas of Western Europe, and particularly in the UK, where our gross inequalities were so exposed by COVID, people are now saying we cannot continue with this kind of society. And remember, one of the reasons Britain moved from being a social democratic state to a neoliberal state after Thatcher, but one of the reasons I stayed in the UK was precisely because people cared for each other, which now Canada's doing that in a way that Britain is not. So I'm glad to hear that discourse here. And the other one is to keep greenhouse gases down to 1.5. So I hope that the US will join the rest of the world in fighting for that. And that means reducing fossil fuels. And it's good to see that there are lots of countries now that are encouraging renewable energies, wind farms, heat pumps, solar panels, you name it, there are lots of them. And I think these items that I've listed here for you are all crucial in setting up a new world after COVID. And we as social workers, as essential workers, have a huge role to play in that. And I gave you the 16 different ways that we could do it, or 13, whatever it was. And together, I think if we work as a unified profession globally, we will succeed and bring this new world forward. So thank you very much for inviting me to talk to you. And I hope I've given you something to think about in that. And I'll now stop sharing. And
Yes. Yes, you've given us many things to think about. And I think we have a lot of things to think about in terms of the green perspective, the framework that you've outlined for social workers to think about their involvement and intervention on this important issue. Thank you, Lena, for that presentation. And we'll have some time for questions. I'd like to turn now to Dr. Cruz, Joel Cruz, to give his presentation. Thank you.
Thank you, Ms. Corbin. So again, my name is Joel Cruz, and I'm Senior Director for the Institute for the Hispanic Family and Strengthening Families program here in Hartford, Connecticut. I will be remiss if I did not say, it's truly an honor to share this time with such distinguished panelists and for the opportunity to connect with so many. Just to give you some context from my end, I oversee many services, but one of those services is our senior centers. This is more of a place where seniors come in and they connect socially. So it's not a daycare program. Most of these seniors are, they have the mobility. Many of them still live alone. They're not in assistant programs. And what we saw at the very beginning was just, wanting to act towards closing our centers because we didn't want our seniors to be exposed to such a deadly virus. And so we started with closing our sites and making sure that seniors were not coming in. Here we are in November and our sites are still closed. And what we've realized is what I think, even as I point the finger to me, was not just looking at the physiological and biochemical effects of the virus, but most importantly, to pay attention to the emotional and psychological effects that the virus is having on specifically to our elderly population. I think it wasn't done intentionally, but we've definitely missed the emotional and psychological effects it has on our elderly population and many others. We could talk about children as well. Not too long ago, I had my youngest, so I have a 22-year-old, and then my youngest is 10, and she just shared, she was crying, and we thought something was wrong. Clearly something was wrong. And so I asked her, what happened? Did you get into an argument with your older sister? And what she said to me was very profound. And she said, I'm just overwhelmed. And for a 10-year-old to have to say that they're overwhelmed, it really touched the daddy hearts or the daddy heartstrings, because again, it brought to the forefront the emotional and psychological effects that the virus is having on populations, on just humanity. Throughout these months, the staff of our senior centers have witnessed a slow emotional mental health decline for many of our seniors. And from crying spells to signs of anxiety and depression, this physical isolation has really turned into a mental and emotional isolation. I saw a video that made a statement, and it said, we can still connect socially and keep our physical distance. But I think for many of our seniors, the physical distance has also impacted them so much in their social connections. In our works, we've placed intentional activities to connect with our seniors by calling them more frequently, doing wellness visits, planning opportunities for them to drive by our centers to wave hello, and at the same time provide them with groceries and personal items. Some of the other things we've done is we've tried to do virtual Zumba classes for them, or opportunities for them to connect as much as possible. But most importantly, friendships built throughout the years of participation in the center are a little different. Their friendships, although they can still connect via phone, there's something to say about the power of in-person, the human connection or the human embracement that they enjoy so much, just being able to connect with others with something as simple as playing dominoes. I used to get on them so much because I would say, like, dominoes is not the only thing you come here for. Yet now that as I look back, it was so intentional. One, they can stay alert with the numbers they're counting. But two, just to be able to connect with others through just playing dominoes. And I think this pandemic, we've paid again so much attention to the biochemical and physiological of it that we've forgotten the emotional and psychological piece of it. And there are moments where I wish both the medical and the social services or social working of it would really be a marriage, because it is so important that they're both addressed together and not in silos. I think there's much to learn from that, that as we see these pandemics, or we see these physiological, biological events, that we pay closer attention to how much the social services piece is important to it, and that we don't try to address one first and then the other, but that we mirror them and we do them together. And you know, as we, it's vital to assisting individuals sort through the emotional, psychological, and social effects of COVID, and just looking at social work as also the hospital for the mental state of folks, the hospital for the emotional and psychological effects of folks that are affected by it. And the last piece that I've seen is specifically for the senior centers that I oversee, which is primarily Hispanic population, and it's just the challenges that they have with accessing or understanding technology. And so as much as we try to meet the needs by creating virtual opportunities for them, we have also seen the challenges they have with accessing technology and understanding technology. So we've had to shift from that as well, and making sure that we spend some time with them so that they can understand how to join maybe a Facebook Live Zumba class, or be part of a Zoom call or other platforms, just so that they can connect with each other and at least have that social connection that is so important to the lives of all of us. And I will turn it over back to Ms. Corbin.
Thank you, Mr. Cruz, for providing that perspective. That was wonderful to hear. I want to just remind those in the audience that they can submit any questions that they have that they'd like the panelists to talk about. But I think I would like to ask the panelists if they would respond to something that, Mr. Cruz, you started at the end. You talked about the importance of focusing on communities of color, particularly the Hispanic communities. And I think sometimes as we talk about responses to COVID, they seem to be responses that apply broadly. And as we drill down in terms of what specific communities need, particularly communities in the US, maybe Mr. Cruz, you could talk specifically about that, and then we can ask the other presenters to carry on. But what is it that, as we talk about specific communities, are important for social workers to think about and address as they engage and enter our communities during this particular time?
Well, I can just at least speak from like the Hispanic community. You know, I actually, we share this, and it's something that happens, at least for the, I'm Puerto Rican. I was born and raised here, but my parents are Puerto Rican, so my heart is in Puerto Rico, even if others don't want to think I am. And we're very huggy, kissing, very tight-knit community. And so when we talk about social distancing, it's very hard. You know, I can tell you, my dad begs me to bring my daughters. He'll tell me, I don't care about COVID. And I'm like, Dad, you have to. He's like, yes, but my family's more important. So when even the messaging, sometimes the message could be in a way that's not as, I guess it doesn't connect with a community like the Hispanic community, because we're being asked to do things that are part of our fiber. And so how do we share that message without having like somebody like my dad feel so frustrated, although we all are in many different levels, but sharing that message of it's not socially, but it's more of a physical distancing. You know, we can still connect. We can look for ways, innovative ways to connect. And so I think the message alone sometimes means the difference between getting someone to follow what we're being asked or not follow what we're being asked.
Thank you. That was wonderful. I wonder if Lena or Vilma have anything to add to that, in particular with the communities? I know in both of your presentations, you talked about the specific populations, but how do we translate that to populations in which there are diverse populations living together? I wonder if those are areas you can provide some insight around.
Vimla, do you want to go first? Vimla?
Lena, I think you should.
Please go ahead. Please go ahead.
Okay. Yeah, I think that was a very important point you made, Joel. And it is one I think that resonates with many different communities. I happen to have a Calabrian Italian heritage, and touchy-feely kisses, they're the norm, yeah. And it's very difficult, I think, to tell people to socially and physically distance. I also know that here in the UK, which is not seen quite in the same terms as touchy-feely, the people in older people's home, these are older people in their 80s, 90s, and some a bit, there are some over 100, they've been complaining that they can't see their grandchildren, that they can't touch them, that they can't see their own children, but they're less worried, which is interesting. And I always used to think this about, my mom died a month before COVID, so I'm glad she never saw this. But she always used to say, you got to bring you got to bring the grandchildren to me, because I don't like the fact that you all live, far away. She wanted everybody to live in the same house as her, which happened at least 2 or 3 times a year when everybody descended on her. But there's a need for human beings to touch each other. We're social animals. And this is what COVID has really kind of challenged us to think about ourselves differently. And what I'm struck by is the resistance by all people to do this. And I know that one of the reasons that Boris Johnson over here is so unpopular at the moment is because of this social distancing, because he's saying no more than 2 feet close together and no more than 6. And now under lockdown, you can't even have people in the same household. We're not supposed to touch each other, So even if you're there with your husband and your kids, you're supposed to keep a distance. Well, people aren't going to do that, are they? And the statistics speak for themselves. And young people now, this is really interesting from the majority group of young people. They just said, well, you know what? We're a low risk group and we're going to go and socialize. So they've been having their parties, including at universities, which is why the second wave was really started at universities where students weren't as strictly controlled as at Stirling. So Edinburgh, and then they called it Pollock Prison because the dorms became COVID scenes. And they were saying, we came to university to meet other people, to socialize. So why are you telling us that we can't do this? And then they complained that the universities didn't do enough to help them survive the quarantine people. So I think, and there was a study here in the UK on touch. And it was amazing how many people said that the biggest problem that they had with COVID was not being able to touch other people that they wanted to touch. Of course, it has to be a wanted touch. And then you think, as social workers, I certainly have a thinking, well, we've been told under, because people might be abusing children, but children, if you give them the environment to tell you it's an inappropriate touch, they'll tell you. But children do want to be hugged. They do want to get up close and kind of, have that contact. So I think it raises so many questions for us, but this study showed that it was the biggest problem that people had with the social distancing was not being able to touch others that they felt they were entitled to touch, not in the nasty sense of the word entitlement, but because our relationships, our social relationships are one of close intimacy. And that's what you were saying to me, Joe. Your dad is saying that to me as well. I want that touch because it is important in validating me as a human being with a place in this world. It is around my family, okay, but that's fine. That's it from me.
Thank you. That's wonderful. Vilma, did you have something to contribute on that particular question?
I think that Lena has put it very well. And in our Indian society, you know, hugging, kissing is very common across all communities. And we are a very demonstrative society. Even though we are advocating that, you know, you don't shake hands, you do namaste, you know, and use the Indian way of greeting. But I mean, I'm not aware of studies, you know, showing how people are responding. But children, I mean, are not kept away, let me tell you, in the families. And we are living in such crowded conditions that there is just no chance of people not sitting together and chatting or even celebrating. They have been celebrating festivals, even though they know that they will be at risk. They even don't wear their masks. So it's very difficult, you know, in our context. Even now, Diwali is being celebrated by people. They've been going to the markets, they've been shopping, and of course, they are picking up infection. In fact, the infection rates are again going up because of this kind of open celebration. So it's a real issue, and I think it also becomes a mental health issue. That's a very, in fact, we've had several webinars discussing mental health issues, even of students who are not able to meet their friends, you know, young kids who are not able to socialize. And what is the impact? There is impact on the family, especially on the women at home, because it becomes greater responsibility for women to keep their children entertained, which is very, very difficult in many households. And the mental health of women is often neglected. Also, there is more abuse happening because the men cannot go out to work. They are not, you know, they've lost their jobs. Even they cannot go out to drink. So they are, you know, sort of taking out their anger and frustration on the women at home. So abuse, women violence has increased, and also violence against children has increased. I cannot tell you the statistics now, but this is what is happening in our context.
Thank you. Important. There have been two questions that have come in, and I know we've got 5 minutes left to our time, but I will just read the questions because I think they're important for the audience to hear and for you to hear. One of them is, what is the most challenging part of working internationally? And I believe as the guests and participants are listening to your responses and your presentations, there are many points that could be challenging in terms of social work implementation. A second question relates to spirituality, and maybe we can take just a brief time to talk about this. The question is, in my experience working with communities of color, besides the value of family and being socially close-knit, how does spirituality intersect with COVID-19? Many will say, if it's meant to be, I will get it and God will protect. So, and I'm sure we've heard that kind of thought before. Could we take a minute or two to get your responses to that? Because I think many social workers are encountering families that have those kinds of thoughts and questions. And if anyone wants to start with that, that's fine.
I can. So my other hat is that I'm also an ordained minister, and it all comes with messaging from the message again from the leader of the religious institution or of the congregation, where you know the leader is clear about the expectations and caring for each other. I love a quote that our pastor shares with us, and it's freedom comes with responsibility. And I love that because it really does. Yes, we're free. And yes, we have our belief system, but that also comes with responsibility. Just because, you know, I believe that my higher power is going to catch me if I jump off a building, why would I do that, right? So I think the message is what's important when connecting with the congregation and the parishioners that attend those services, so that we're all on the same page and that we're not bringing conflicting or messages that are a bit confusing for attendees.
Thank you. Yes, Lena.
Yeah, I think that's a really important question about spirituality. And there are two ways in which I would answer it. One is that I've noticed that when I've worked with Muslim communities, they are more likely to say, well, if I'm going to get it, I'm going to get it. And if I survive, that's because it's God's will, inshallah, you know. So that's one way of looking at it. And I think it's important that people respect those views, even though they're not very comfortable views. But I know that my government does not take that view. It says, if you do that, then you run the risk of infecting other people and putting a burden on the social good of the free national health service, which we have. So there are pros and cons on both sides. But the white majority British population under COVID discovered spirituality through nature, because the only thing we were allowed to do during lockdown was to go for long walks. You were allowed to go for an hour's walk. And most people in Britain, which is hard to believe in a tiny little country like this, if you walk for about 15 minutes, you will either find a park or an open area, because we're allowed to roam through fields, farmers' fields, and so on. So people were doing that and discovering nature for the first time in their lives in kind of modern, like post-World War II Britain. And they were finding birds, flowers, trees, animals, you know, the little animals that we have here, not like the big wild animals of Canada and the US. But they were discovering them for the first time and hearing birdsong and everything else. So they called that spirituality. And I, as a Greek social worker, I think that's fantastic. Let's value those things, because they really do make a difference to our lives. And what Vimla was saying about mental health, a lot of our respondents, because we did a bunch of surveys too, they were saying that actually, this is what kept them sane, connecting with nature.
Thank you. Any other comment? I know we are at our 10:30 time, and I know people are in different places around the world, so I want to be respectful of that. I have the responsibility of wrapping this up, and it's really hard because we've heard such impactful and profound lectures and presentations from each of you, and it's very hard to summarize this. But I would say, and I would ask the participants, those listening in on this, that you're taking away something that is important for you. So each of us has a responsibility to learn from what we've heard today and to think about what is meaningful in our work. And for me, I think an aspect that's really important is the issues of the interconnection. And I will use the terms, we talked about the macro issues that are affecting social work. And I think about Vimla's presentation in terms about not only the assessment, but the intervention at the macro level, and how governments and nonprofits really support individuals around COVID, around the meso level, around the micro level, even thinking about how social workers are needing to be in communities and in those family homes to really see what is happening. And that's most important. I think about Lena's comments in terms of looking at the green perspective and the holistic responsibilities we have, and presenting that framework for understanding not only our assessment, but our interventions throughout, and our need to advocate at the policy level for some changes that will impact not only regions, but globally. And I think about Joel's comments about the importance of family and social workers being related to the populations that they're working on and staying in close connections to them, particularly the issues of isolation and separation that can be so detrimental in this time of COVID. And I think one of the things you've all talked about is the importance of messaging. How do we understand? Lena, you talked about social workers being at the forefront of translating the information from research to ways that populations can hear this and be meaningful. And I think that's really a big part of what social workers can do in translating the knowledge we have about COVID-19, the importance of staying related to communities, the importance of staying related to the governmental and non-governmental agencies that support the work, and then the messaging that is most drilling down to the populations in terms of the messaging that people can hear around touch, communication, being in relationships to one another, the physical and social distancing that are so very important at this point in time. And so I thank you all for bringing those messages home in understandable ways and very practical ways. It's wonderful to be a part of this group and listening to these esteemed panelists. I thank you for being with us. I thank the audience for being a part of this. I thank the organizers of this presentation. And so on that note, I would just wish everyone to stay well and to continue to be engaged in this work of social work wherever you are. Thank you.